guys, this is Gemma from ASD Rocks, and this is psychologist Carlo Saba from Clear Thoughts Counselling. Now Carlo specialises in a number of areas, autism being one of them, which is how I know him, but the other areas are cognitive behavioural areas, that's always hard to say, adolescent psychotherapy and psychology, trauma counselling, family therapy, PTSD, relationship counselling, which I think is really important in the ASD world, social skills, anxiety, and so much more. And a lot of this is going to be very relevant to people who are not on the spectrum. So, although we're going to stick to very much a subject about the autism spectrum world, a lot of this really does apply to people, especially thinking of ourselves as parents, grandparents, those sorts of things, to take a peek and a look into ourselves and how we manage these sorts of things and how we're doing with the questions that I've got here. But Carlo and I met about 11 years ago. So that was when I was introduced to him when Beau was 2 years old, and he was non-verbal. How long have you been a psychologist, Carlo?
Practicing for 13 years, and 2 years before that as a provisional psychologist, and then a few years before that as a counsellor working with young people and the families. So a few years under the belt now,
15,
actually.
yeah, quite a few years, goodness me.
It's hard to believe where time goes. 11 years, I can't believe that.
Did you, because you work a lot with ASD though, don't you, specifically? And how did you sort of fall into the ASD world? Was it just sort of that presented itself and was on the uprising, or?
Look, that's true, and it was at that stage. A former supervisor of mine, Renati, who created the organisation Sensational Kids. She used to supervise me through my registration period, and she developed a private practice and asked me to come along and work with primarily private patients at that stage, which then opened up to the field of ASD.
Because I was given, the way I was introduced to you was I was afforded a number of sessions through what used to be called FAXIA, which then turned into HCA, which is Helping Children with Autism, which now is all across the board being turned into NDIS. But there are other ways to get funding. So what's one? We know that we've got the mental health plan that we can get from our GP, which gives you...
The mental health care plan through a GP assessment is 6 sessions to begin with. And then upon review of those 6 sessions being concluded, a report gets fed back to the doctor based on progress and further recommendations, and you're eligible for another 4. So that's 10 sessions per calendar year per person who's eligible, and quite often that can be mum and dad or both. And that's also the child, if needed, on top of further funding through NDIS. There's another program also called FRSC, which stands for Family Relationship Support for Carers, and they provide the provision of support for parents of kids with special needs, but carers in general disabilities, not just ASD.
That's actually brilliant. How many do you get?
It's 5 sessions per parent. So mum could be eligible for 5, dad could be eligible for 5.
Regardless of their marital status?
Yep.
Okay,
Yep.
So I could, if I wanted to take it, because I actually want to take advantage of that. I'd really like to take advantage of that, guys. I've been doing therapy for 11 years, and I'm only the better for it. So if you do find these ways of getting these sessions, for example,
FRSC.
Take advantage of it. Anything that's going to help you, especially with the hip pocket and especially with the head.
Yeah, absolutely. Do both.
The head and the heart is definitely a bonus. So how do I do that? Do I just type in FRSC onto the computer? And
well, you have to be registered with them as a provider. So as a psychologist, I go through a registration process based on experience and the types of people I work with. And so then I've got application forms.
Oh, so I can come straight to you,
straight to me.
ask you for an application
Yep.
form, and we send it off, and
That's
then
right.
and then there's and the FRSC. How much does that cover?
It's 5 sessions,
Full.
full. Yep. So there's no
The
out
full
of pocket
amount,
expense.
There's no out of pocket.
No,
Okay,
not
so
for
there's
that.
an out of pocket with, or there could be an out of pocket depending on your therapist's or psychologist's charge
Yep.
for the mental health care plan, but no out of pocket with the FRSC. So get onto it, guys. That's a
Yep.
really big
And
one.
it's available.